Welcome to Imperfect Heart, a place for you to join me, Jeff Holden, in conversations, discussions, and dialogue about our hearts and the impact myocardial bridges have on them. We'll talk with healthcare professionals, those in related fields that support our condition, and others just like us with stories of their myocardial bridge experiences. It's my intention for this content to inform, educate, entertain, and even motivate or inspire you in your personal journey on dealing with a myocardial bridge. Most importantly is to have you leave each episode with hope, knowing you're not alone and that what you're experiencing is real. This episode is an Imperfect Heart Journeys episode, as our guest is sharing his experience getting to the ultimate objective, unroofing surgery. Any of us who have been unroofed recognize some, maybe all, and in some cases even more than you'll hear, the challenges and obstacles we can run into when we're desperately trying to find a solution to our situation. Imagine working the necessary steps, the education, the procedures, the trips to the ER, the misdiagnosis, and finally getting confirmation of what your problem is. Yes, we know it's a myocardial bridge. Well, you're almost to the finish line, right? Surgery's imminent and you're going to be feeling so much better afterward. Not so fast. Now a whole new set of obstacles present themselves. My guest this episode explains how close he is to a solution. Already had his surgery scheduled with Dr. Guy in a few weeks, only to have it all upended by an insurance denial, now leaving him basically starting from square one on the process again. We'll talk quite a bit about the insurance conundrum and steps to take, but let me introduce him now. He's a father of two, grandfather of three, and married for over 20 years. You'll recognize the significance of the relationship with his wife and his life partner, Lisa, in our conversation as well. He's an engineer by training and was most recently chief of staff to the mayor of San Jose for 8 years. He's now retired and living in Arizona, was cycling competitively until his condition ended that pleasure, of which you all know I can relate, and he couldn't resist the call to public life, finding himself now on the Sedona City Council. He brings a lot to the discussion I'm sure you're going to appreciate. Pete Furman, welcome to Imperfect Heart.
Thanks, Jeff. It's great to be here. I want to thank you for doing this all the time.
Absolutely a pleasure. You know, Pete, I don't want people to think that they have to be athletes or have been athletes or competitive fitness experts to get interviewed. But I think there's an interest to share by those who would have been deemed least likely to have a heart health situation. And that would be somebody perceived to be in great shape. And that would also be somebody like yourself. You're a cyclist. And while I'm a cyclist, I think you're a bit more competitive cyclist than I. And I look forward to riding with you at some point after the surgery. But would you share the start of the awareness of what it was that something wasn't right? You noticed that this isn't right.
Yeah, thanks, Jeff. Yeah, truly, I didn't really get started serious cycling until around 2010. And it was right after that. I don't think it's coincidentally. I was going to say coincidentally, it's not. I started feeling a bunch of tingling in my left hand. And this was up in the Bay Area, and I went to all the docs, and we did everything. Every test, they diagnosed stuff. They retracted those diagnoses, medical trials, nothing. And in the end, they said it was idiopathic peripheral neuropathy. Idiopathic means we don't know. And so we just kind of gave up. And I learned to live with that hand tingling and numbness. And then many years later here in Sedona, I went to a doctor talking about a decline in my athletic performance and feeling problems with heart rate and feeling and a breathing rate. And they diagnosed me with exercise-induced asthma. And it was at the start of COVID, and they said, we'd love to send you to a pulmonologist, but we can't find one. You're not going to get one. There's more serious cases than you. So here's a inhaler. Try it. I tried it. It didn't do anything. And then, a little bit later, a year later after that, I complained to my primary care doc about jaw pain. And, she felt there's no glands, there's no nothing. We don't have any idea what it is. And we all, I think, get used to people saying we don't know, and we learn to live with what we have.
And for the benefit of those, neuropathy is just nerve pain.
Yeah,
So
yeah,
they were calling it some nerve sensation thing in your
yeah,
jaw, not necessarily related, or at least nobody was connecting the dots, when
right.
in fact, if you put those all together, you realize, okay, decreased performance, some jaw pain, pain and tingling in the arm.
Yeah, yeah.
Uh, we might have a path to explore here.
It was after I was diagnosed with my bridge that my primary care physician just shook her head and she said, we would have never thought. You came to us talking about hand tingling, jaw pain, chest discomfort, weird sensations, and we never, ever thought you were a heart candidate.
Hmm. Back to the opening of somebody who's in great shape. And I think a good alert for anybody who's experiencing any of these symptoms, angina, chest pain, tingling, don't assume it's not your heart just because
Yeah,
you know yourself to be in good shape.
yeah, yeah.
And to the point of cholesterol and lipid panels and blood workups, all that can be good. And in most cases, for us, it is for many of us. So don't make any of those assumptions. If you have this sensation or any of these sensations, do something about it. Don't wait.
And
So,
even learn when they talk about chest pain. You mentioned chest pain. I
mhm,
ride, one of my riding buddies is an ER doc. And he used to ask me all the time about chest pain. I was like, no, I don't have chest pain. And, after some amount of time, he said, all right, stop, stop. What are you feeling? And I talked about the pressure. I talked about sensations. And he just shook his head and he said, in the medical field, that's chest pain. So you really need to be liberal in assessing some of those feelings.
so something occurs around July of last year, July of 2023.
Yeah,
And all of a sudden now you're a frequent visitor to your local ER, and
yeah.
it's much more significant chest pain. Tell us a little bit about that.
Yeah, 6 trips to the ER in a year, almost exactly,
Ugh.
6 trips to the ER. My first one was in July of 2023, July 10th, I think was the date. And I was riding with that ER doc buddy of mine, and I denied chest pain. And the third episode of it, that's when he really went into, what exactly? And after telling him, he said, no, we're going to the ER. We're going to the ER. And so, yeah, we went in, and because of my symptoms and my family history and some, the stuff I had reported in the past, the doctor in the ER said, no, that's good enough for me. We're going to send you down to Phoenix, threw me in an ambulance, and they took me down to Phoenix where I had the first real
Hmm.
workup. And I think I'm amongst the lucky cases that I hear reading all our site is, that first serious trip is the same as everyone else. We can't find anything. We can't find anything. Oh, we did see that little plaque turned out to be proximal to the bridge like everybody else. So they went in there to maybe think about stenting it. But the cardiologist that did that work, that interventionalist, he went a little further and saw the bridge and backed out and didn't do anything, thankfully, and then told me, hey, you have a bridge. I don't know anything about the treatment. Find a specialist. I don't even know one for you. Good luck.
Wow. Wait, the good news is he didn't do anything, didn't shove a stent in there and say, well, we think we got it,
Right,
only to find that now you really made a mess and have a serious situation on your hands.
right. Yeah, yeah.
So what took place, from that July forward in your diagnostic process? How did you get to somebody to identify that there's something else going on here now that you know you had the bridge.
Yeah. Yeah. I mean, the bridge was the target right away because there was nothing else wrong, right? Even that diagnostician that I talked about, the interventionalist, he had said, your heart is remarkably clean for your age, thanks to your fitness and whatnot. So the only thing that we can even see is this bridge. And my local cardiologist, he also said, wow, that's very interesting. I've heard of it. I think we spent 10 minutes on it in med school and I don't know anything about it and I don't know anything about the treatment. And that's when my insurance plan, Blue Cross Blue Shield, gave me a internal resource, a complex case care coordinator, I think was the name, her title. And the first one I had there, she actually helped me find a specialist in Tucson that knew that that knew something about this, knew about spasms primarily, I think, and knew about bridges, and took me through the provocative cath for the first time. But in the meantime, after that first trip to the ER, there were two subsequent ones pretty close, two more pretty close together because I was really suffering at that point. And, you learn to how to deal with the ER staff when you're going that frequently. So I think I know them all now at the ER, except when they turn over and, we all establish our own set of criteria of when we decide to go again. And it's like, well, if the pain was more than ever before, or there was some new type of symptoms, that was my marker to go to the hospital, tell them right away, I've got a bridge, I've got a long history, read my record. We just need to check my EKG and my troponins. And if I'm okay, I'm going home. And so, you learn to manage that way. But my specialist down in Tucson talked a good game, but didn't really understand kind of the treatment protocols. And subsequently, I found out that he messed up that provocative cath. It didn't follow the procedure, didn't really run it to its proper conclusions. And then his drug therapy regimen just wasn't good. I didn't do well through it. I didn't handle the meds well. He wasn't checking the blood markers. After that, I started to have liver failure from one of the drugs. So it's been a disaster. And then I got real serious about it. And that's when I met Dr. Kofidis, Dr. Shaw out at Yale. You know, I had originally applied to Dr. Schnitger's program way back at the start, but that took me 11 months to get in. Did meet her. She's awesome. I met Dr. Henry and Dr. Guy out in Georgia. They're awesome. So there's some really friendly, helpful people that we can find. But, you have to be persistent. You got to be proactive. And you got to know when your local people are bluffing you.
So you actually had a locally administered provocative test. Was it the full acetylcholine and dobutamine challenge test?
They shortcut some stuff, Jeff, because they saw that I was having a vasospasm right at the start, right when they went in. And so they kind of shortcut some of the process. And when they did the dobutamine challenge, they didn't challenge me very much. They only got my heart rate up to 114, I think. And his target was 140. And he bailed out. I've come to find out later that he didn't really administer the dose that he should have. And so there was just 4 or 5 things that were incomplete. And what's all the rest of these doctors, they don't want to criticize someone in their profession. And so they say things like, well, that was kind of incomplete, or, they use very kind words about what the heck happened there. Yeah.
Right. So was your sensation, did you identify at least through that process that your sensation was in fact the endothelial dysfunction, the pain that you got? Because you didn't seem to have the shortness of breath. You had chest pain, correct? And some of the, the neuropathy, the tingling and numbness.
Yeah. I mean, that's certainly for sure. For me, it started with more like chest discomfort that evolved into burning sensations. And then I would start to, I got that jaw pain, and that's almost one of the most consistent things that I get is pain on the jawline, radiating pain, the numbness and tingling in the hand. And then it's gotten worse over time. So now it's real chest pain. It feels like somebody reaches out with a hammer and smacks my heart. And I can correlate it. I certainly know that activity causes it, but it often feels like it's delayed, or I'll get some version of it when I'm exercising, but then maybe that night, that Prinzmetal angina, you get that spasms at night kind of thing. And I think I certainly, being a mechanical engineer, am absolutely convinced that it's a mechanical process, that it's the squeezing of the coronary artery that causes some angina during exercise, but then afterwards it causes that vasospasm. And yeah, yeah,
So, in the conversations that you've had to date, as they're looking at opportunities to treat the vasospasms, have you had any sensation improvement, or I should say improvement of the pain from the cessation with any of the medical therapies?
yeah, that's a great question, and a question that I've challenged all the doctors on that I've talked to so far, because there has been. I'm not going to the hospital as frequently as I used to. Um, it was 3 times in a row there in 2 months kind of thing. I mean, it felt like it was really bad. And then I got on, for me, it was the calcium channel blockers and then some other things that were supposed to help enhance the effectiveness of those. And and certainly the pain isn't as bad as it used to be. But the question I ask everyone is it the drugs, or is it the lack, not exercising anymore? I'm not agitating it as much as I used to. And nobody really knows the answer to that question. But then July 7th of or 10th of this year, so it was almost exactly a year later, Jeff, I had a very significant episode. And was Dr. Henry said, that he was sorry that I had to get through. I got there. Sorry that happened to me, but I proved to him that all the drugs trying to treat the endothelial dysfunction and the vasospasms weren't working, and we needed to do the unroofing surgery.
Mhm. So you must have gotten to that point that I refer to as that tipping point, because we know the condition never improves. It only gets worse. It
Yeah,
deteriorates. But
yeah,
because you were masking it with some medication, and I mean that in a positive way
yeah,
because it's a therapy that we try. So
yeah.
you've now got it, masked a bit. You're not exercising, so you're not aggravating it as much. So it
Right.
just took a little longer to get to its tipping point and
Yeah,
say, you can mask and medicate and do all you want and stop your exercise. I'm still going to irritate you.
yep.
And
And it
in
was,
fact,
right at the end of that, Dr. Henry had asked me, if I felt comfortable to try getting a little exercise again. And so I did 3 days. I tried to ride my bike super gently. I don't even call it riding my bike. I was on my bike pedaling around the neighborhood. And so it was just 3 days of that then reignited it in the worst way.
yeah,
And
because now
ever
you've had
since
that.
then, it's been significantly worse. Yeah.
Yeah, and you had that time in between where it deteriorated, so then you go back on the bike, and
Right.
boy, brother, can I feel your pain on that one because I know what that's like for us when we get on something that we know we're capable of doing
Yeah.
prior, what that was like, and here we are now, you know, spinning like a tricycle training ride.
Right.
I almost
Right.
embarrassed to put the shoes on and clip in and and go.
I have a
You know
beautiful training app that shows me my power profile, on all the different segments of ride. And what I did those 3 days was just this minuscule circle inside it. It was so easy. It was embarrassing.
of course, you're an engineer, you would have every detail monitored to the nth degree.
Yep.
So you've connected with a couple of doctors now. You've got a good understanding of what your condition and situation is. And you even got past the original diagnosis to the acceptance of the fact that you're probably a good candidate for unroofing.
Yep.
And that's a lot of work in itself, as many people know. What happens next? Because you get tangled up now in the ability to get the unroofing surgery.
Yeah. Yeah. I live in Sedona's in northern Arizona, rural northern Arizona. although it's only 2 hours from Phoenix, but still it's kind of rural up here. And and so the health plan I'm on is Blue Cross Blue Shield. It's an HMO plan, and those are notoriously difficult for getting services out of their network. But I will encourage everyone to know that it's not impossible. In everyone's plan, there's an option for that. And I was working with this case manager, and I kept them apprised of every detail and every thought that I was having. They knew right away that I wanted to go to Stanford. I started talking about Dr. Guy and Dr. Henry when I think you had them on your show, started talking to them. And they knew every step along the way, but they didn't say anything about out of network or in network until Dr. Guy and Dr. Henry decided that it was time. Let's schedule you for surgery. And they submitted the plan to Blue Cross Blue Shield, and it was denied because they found someone in network that could do the surgery. And so now we had a surgery date at 9/5, and now that got canceled. And I have to kind of start the process again of thinking about this new surgeon and whether I feel they're qualified, whether I feel I'm comfortable with them, or, there's the multi-level appeal process that you can work through as well. So it's really important for everyone to truly understand what their health plan is. And it requires reading of detailed contract language, but it's important to do that.
And to that point, so many of us, we see it on the Facebook group page, people that I've spoken with through the podcast have just had a really difficult time navigating our own insurance policies and understanding what the policy provides, what it doesn't provide, what services are allowed, where they're allowed.
Yeah.
Each of the hospital systems have their own concierge person to help support us through that process as well. Did you engage with anybody in the hospital system to help from the back end in, outside in?
Yeah, certainly at Georgia Heart, when they were preparing the plan, they've done this before. They've gone out of network and submitted their plans at other places. And this was the first time that they dealt with Blue Cross Blue Shield Arizona. And they ran into trouble. They would call in and they would hear that, well, these procedure codes don't require pre-authorization, but they knew they were out of network and they were asking that question and got a bunch of head scratches and we don't know. And so they got the runaround at first until I asked my case manager to help out, and they finally got the no answer. And the same thing happened to me at Stanford. Stanford submitted, they said it wasn't required. They were confident that it didn't. And I don't know how that's going to turn out yet. I may have to eat the cost of that exam. But I also feel at the same time that, getting Dr. Schnicker's thoughts into the case as well was a useful thing. So we'll see. I don't know yet, but managing the system is very difficult because, especially I think with HMOs, they're just not used to looking outside the plan. But there is a way for everyone to do it. And in every one of these plans, there's a thing called the gap exception agreement. If the plan doesn't have providers in network that provide that service, then they just negotiate an agreement with someone outside the plan to get whatever rates and payment plans and all the rest. And they can do that, and it's allowed for in the plan. But it's difficult to get there because the people that first answer the phone call from the doctor to approve or deny stuff, they're not really up to speed on that.
So let me ask, did you actually have a provocative test done at Stanford as well?
No, not the provocative test. I had Dr. Schnittger wanted to repeat my CT angio, and we did another stress echo there.
Okay. So you did have some testing, you just didn't get all the way through the entire process. All right.
Yeah.
And thank you for the definition and the identification of that gap plan, because it may work differently for somebody in a different state. We just don't know, because so many of these things are unique to the individual case. And we do know that people tend to, and I don't mean us, I mean the people on the other side, on the administrative side of the insurance companies, may look for the path of least resistance. They don't
Yeah.
see this myocardial bridge thing, but they see somebody out of network that'll take it. You might ease right into it. And I suspect that we've probably spoken to somebody that has had that experience. If you hear the episode and you have, please reach out to me because I'd like to be able to share it with others. But for the benefit of those, do check and look into your gap plan because some of them aren't quite as visible in the policy as others.
Yeah,
For
Jeff, I'm an engineer, and so when the denials first started being talked about, I did a lot of research looking at plans, and United Healthcare actually has their gap exception agreement document on their website. They, but nobody else does. No other health plan that I could find talked about it, but certainly the language is in there in my plan in the details of it that talks about if there's no in-network provider, then this is a thing that could happen.
Yeah, and thank you for mentioning United Healthcare. That happens to be the provider I had, and it's one of the exercises we recognized. I didn't have to go out of network. I had to go out of network, but not out of state.
Yeah.
So we were able to find, a remedy within state, and by the good fortune, in my case, it happens to be Stanford. So it was a good solution.
And then you also need to understand the appeal process available to you. So you read your plan, right? And so there's 3 appeals that I am entitled to. 2 of them are internal to Blue Cross, and the third one, if you exercise that, has to go outside. And these are ACA, American Healthcare Act plans,
Hmm.
and these are ACA requirements that they have to implement these things. So I filed for 1 appeal already. I'll go see this new surgeon they've offered me, and we'll go from there.
And let's address that now because you are one of our journey patients. You're not unroofed yet. You're in the process, which is why I thought it would be so valuable for somebody to hear the insurance stickiness of it, where it's holding you up. You've gone to some of the best cardiac surgeons. You've had connection. You've spoken with people at Stanford. You've spoken with people at Georgia Heart in Atlanta, and here you are now stuck. And I'm going to say that with quotes on it because maybe these surgeons
Yeah.
have the capability. We just don't know yet. And you did find somebody that's in system that has been referred by Blue Cross Blue Shield, and that's coming up soon. That date is soon, if I'm not mistaken, for you to have that first consultation.
Yeah. 9/3, week from tomorrow. Yep.
Okay. And what is it you need to establish with them? And that's for the benefit of others who are there. As an engineer, I know you vetted this really, really well. What are some of the things that you're going to want to ask and be certain you identify from this new cardiac group?
So here's my list of questions.
I knew it.
And I'll start kindly by asking them, what they've learned from my record and what they recommend as a procedure for me. But then I want to know about how many they've done and, overall in the past year, in the past month, right? To try and get a sense of what their experience is. I think we all understand that, although to us it's mind blowing that this operation is possible. Everyone I've talked to in the field says that technically it's not that complex of operation compared to other things that heart surgeons do these days. But still, if you haven't done it, do you want someone to be doing their first or their second one on you? And I think that's a valid question. So questions about that, asking about what the outcomes are, and asking about post-infection rates, and then about their approach. We've learned a lot from Dr. Kofidis and others about how to do it. And Dr. Guy talks very much too about, I asked about locating the bridge because Dr. Schnicker and Stanford have a very specific way that they go about locating the bridge. But Dr. Guy is like, yeah, I just start at the apex of the heart and I work my way across the whole LAD looking for them. And, that's valuable too. So I want to know what their approach would be, and how they think about secondary bridges. Do they look for them? Do they look for them beforehand? Do they look for them during the operation? Right? There's that list of of questions like that. And then what their involvement is post-operation. What can you expect from the surgeon in terms of follow-up and, watching you through recovery? So,
I know one of the things we're seeing a little bit more prolifically than earlier on the Facebook page in the support group is pericarditis. It
yes.
seems a fair number of people are experiencing pericarditis. And the second part is now that we're getting some time in between surgery and healing process, we know that the endothelial dysfunction does seem to ease over time. And many of the surgeons will say it could be even up to 3 or 4 years by the time it dissipates. But
Right.
it seems to be better for most of us that have had that situation. But the one that I think concerns me at this point, because it's not one that's been talked about much, but it's scar tissue. And could that scar tissue then envelop the artery again to where you may be experiencing some of the symptoms? And while we don't know for sure yet, but some of those people that have been unroofed over the course of the last couple of years, I've noticed have just popped in and said, well, I'm experiencing some symptoms. We think it might be scar tissue. So it's another question I think to add to your list when you experience or when you're talking to your surgeons about the experience and their experience to see what that looks like. I want to get some data on the people that have had this and see if there is a frequency of scar tissue or return of symptoms, because there's not that many people that are out past 5 years. There's a few a few out there 10, 12 years. We just don't see them because they're off doing their thing.
Right.
So I'd be curious to see what that looks like.
Yep.
This is an emotional roller coaster, as we all know. At this point in time, you're close. You're so close to getting the surgery, knowing that the surgery has the ability to relieve the symptoms and get you back to a life that you recognize. How are you dealing with it? How's your head? What are you concerned about at this point?
It is a roller coaster, isn't it, Jeff? I think it is for all of us. And, when I first found my diagnosis early, as I talked about, and I found this, our Facebook site and all the resources that we have. And for me, I did a deep dive and learned a lot. And as a mechanical engineer, I went to the conclusion of my own that this is a mechanical problem for me and it's causing these vasospasms. But the primary cause is this mechanical squeezing. And so my mind is like, well, yeah, then you just need to fix it. Unroofing surgery makes sense. And then you go through the year-long trial of drug therapy, talking about vasospasms and feeling this stuff in a different way and feeling the symptoms change. And then I just start to get skeptical about, geez, heart surgery, that's a pretty big thing. And then, I had this big event back just this past July, and it's like, nope. Even Dr. Henry and Dr. Guy are like, yeah, you need help. We need to do the surgery. So that convinces you again. And then I get the date for surgery, 9/5, and then I get scared. And then I get the rug pulled out for me. And so, wow, has it just been incredible, a roller coaster. And it's difficult. But, I've got a great my wife Lisa and my support network here in town of friends. People. If you're for me, that I'm open with them, and they're open with me and helpful. Sedona's famous for all this energy in town, and there's a lot of people in town that are sending me positive vibes. So we'll get to the surgery. We'll get through it, and I look forward to joining you on a bike ride someday.
Well, and Pete, I can see and I can hear just the attitude that you've got, and that's so important. Not to mention, yes, you've got this circle of support. Uh, I feel badly that you've had this up down surgery, set, not set, insurance, no insurance, because you are so close, and that is one of the most difficult parts. Is when you've got your mind set to go, you start to shift from it's going to happen and it's a maybe, and now it's for sure. And then you start dealing with all the consequences of what that mindset is, because it's different. From uncertainty to certainty is a huge step. And you're sitting in
Oh,
the certainty part. So, and on
yeah. All the
9-3,
while when your symptoms are getting worse, right? I mean, they are getting worse. It's now shortness of breath. I go over and try to pick a weed up out of my yard, and it's like, what the heck?
right. Yeah, and for all of us who are in that position, you don't know. You don't know. I mean, is one of these gonna be the last time I get the sensation? And for the most part, no. I don't think we know of anybody that has had that situation where it was. It sometimes would manifest itself in some sort of an ischemic attack, but again, for the benefit of people listening, in all likelihood, it's rare that you would suffer a massive heart attack under the circumstances. So it's a matter of just keep pushing through, get it identified and keep working through to the next step to get taken care of. So 9-3 is your first consult with these new people, the new cardiology group. I will be in touch with you, and I'm sure you'll probably be posting until you actually have your surgery, which will be wonderful. And then what I'd like to do is post-surgery, there's about 3 or 4 people that we've had who we've talked to in the process of who have now been unroofed, and I'd like to gather you all at some point once you've got about 10, 12 weeks post-surgery and that sternum protocol is behind you, uh, and we can just talk about everybody's experience for the benefit of those who are going through the process.
I look forward to doing that at your next in-person gathering in Sacramento a year from now. I'm sorry I won't be able to join you this meeting, but I look forward to it in the future. We'll have a round table of people.
And we will this time too, and I don't know if you saw Dr. Kofidis is actually going to join us at 10:30 on September 4th as a virtual event. I'll figure out how best to get that to everybody. I'm working on that now.
He's
Well, Pete, you're in
amazing.
a
You
spot
reach
where
out to you reach out to him, you send him an email, and he says yes, and then he spends an hour with you on a video call. He's an absolute gift. Yep.
and it's amazing too because here's a gentleman that's in Greece who is a highly regarded and highly demanded surgeon. It's not just unroofing procedures he does. He's a well-regarded cardiac surgeon. So it is amazing that he gives us the time that he does. And he was clear to chime in. I think most of you, if you're on the Facebook group, saw over the weekend where he gets equally as frustrated as I do when everybody has the solution, and then the people who are looking for solutions assume they've got the same situation. And the medical experts really are not on the Facebook page. They're just there to share their stories. So please don't assume that that's your situation. Every one of us is so uniquely different. Our surgeries become very, very different. Our symptoms are different. Our capabilities and capacity of what we can do are different. And our healing processes, no two of us are alike in what we see. So just absorb that as valuable information, but don't take it as that's your situation. Let your doctor work with you on that. And you are doing a fabulous job of that because you are an engineer and you know that there's specialists that do these sorts of things.
Well said.
So Pete, you're in a spot where many of us, either have been, currently are, or will be as they go through their journeys. And you've really shared a lot of beneficial information. We get that disappointment and know that you still have the hope, moving on to the next necessary item on that checklist of yours. But it's that attitude and positivity that is so, so critical. And that's what's going to carry you through this surgery. So, we're here, we're wishing for you, praying for the outcome that you desire to get this heart function corrected and get this mechanical thing. I will say electromechanical, though. You're going to have to put an electrician in there at some point too. Um, but you're going to get there, and we're there to support you. We hope to see the continuation of the next steps, and then, like I said, once you're back and out of that sternotomy protocol, we'll get a group of you together. So, best of luck to you in the process, and from the bottom of my imperfect heart, thank you for sharing your story with us.
Thank you, Jeff. It's really a pleasure to be here. And you said, everyone that's on this journey, it's different, but there's I find it great to go through the Facebook site, and I thumbs up, people who are taking the next step. So I'll be posting. I was reluctant to post in the past because everything was so uncertain, but I'm going to be a little bit more out there now.
When I think we benefit from somebody like yourself who is very detail oriented, who's really going to do a lot of the homework. Not everybody has the willpower to stay with it. It just overwhelms them in some cases. So having, somebody like yourself who will dig and dig and dig and dig, and thank you for what you did with the insurance. This is the first real insurance conversation we've had. I think it's going to help many.
Yeah.
And so,
Thanks, Jeff.
so thank you for all that work, Pete.
Thank you.
Thank you for listening to Imperfect Heart. It's my hope that this information helped in some way to improve your situation or will help you better understand this condition. More importantly, that it gives you hope through stories that there is help and you most certainly are not alone. If you've been diagnosed with a myocardial bridge, please be sure to join the private Facebook group, Myocardial Bridge Support Group. For more information about our program or to reach me directly, visit the website, myimperfectheart.com. If you like what you heard today, please give a positive review, thumbs up, high five, or whatever your app likes. And be sure to share with everyone important to you so they understand what it is you're dealing with. Please subscribe as well. Welcome each day with gratitude and positivity. The views and opinions expressed in this program are solely those of the host and the guest and are not intended to provide, nor are they a suitable substitute for, professional care by a doctor, therapist, mental health professional, or other qualified medical professional. Imperfect Heart is a production of Hear Me Now Studio.